Hi, everyone. Good morning. I'm Dr. Cindy Ross, and today I want to talk about something that's often misunderstood: estrogen. When we hear the word estrogen, most people think it's bad or that it causes cancer, but that's not the full story. The truth is, estrogen is absolutely essential for your brain, your bones, your heart, your skin, and even your mood. The problem isn't estrogen itself, it's how your body metabolizes it. We actually make three types of estrogen. You have estradiol, which is your E2. This is the powerhouse estrogen. It's what keeps your energy up, your bones strong, your memory sharp, and your metabolism humming. Then you have estrone, which is your E1. And after menopause, this one often becomes dominant, especially if there's extra body fat or inflammation. Then you have your E3, which is your estriol. This is the gentle, protective estrogen often used in your bioidentical hormone therapy because it balances out stronger estrogens. Each one behaves differently, and that's why testing matters. Two women can have the exact same estrogen level, but completely different risk profiles. Estrogen doesn't automatically cause cancer, but certain metabolites of estrogen can. When your body breaks down estradiol and estrone, it can go down three main pathways. You have the 2-hydroxy pathway. This is the clean protective route. Then you have the 4-hydroxy and 16-hydroxy pathways. These are the toxic ones, DNA damaging ones that raise your cancer risk. So instead of asking, do I have too much estrogen? You should be asking, how is my body processing estrogen? That's what advanced testing like a Dutch hormone panel, which is saliva, can show us. It tells us how your liver, gut, and detox systems are handling estrogen and whether your pathways are balanced or dangerous. During perimenopause and post-menopause, your hormones don't just drop, they're fluctuating and they shift in ratios. Estrone tends to increase as estradiol drops, and that shift alone can change how estrogen is metabolized. This is also when inflammation, poor sleep, stress, and sluggish detox pathways can push estrogen down the wrong route. By testing and supporting those pathways, we can use hormone therapy safely and effectively, keeping estrogen in its protective range while avoiding the harmful metabolites. If you're in your 40s, 50s, or beyond, don't guess. You have to test. Ask your provider about testing for 2-hydroxy, 4-hydroxy, and 16-hydroxy estrogen metabolites, not just total estrogen. Support your detox pathways naturally with DIM, sulforaphane, calcium, B vitamins, and fiber. Keep your liver and gut healthy. Move your body. I preach it every single day. Manage stress and focus on real whole food. Estrogen can be your best friend or your biggest risk, depending on how your body handles it. Knowledge is power, and testing gives you that power. If you found this video helpful, share it with a friend who's navigating menopause. Let's spread the message that estrogen isn't the enemy. Unmonitored estrogen is.